My name is Bruno Sunguya. I'm from Tanzania, and I'm a medical doctor as well as a lecturer in a university called Muhimbili University of Health and Allied Sciences. As I said, I'm a medical doctor. I was trained in Tanzania for my undergrads. I graduated in 2006 and got my Doctor of Medicine degree. And then I did my internship in Tanzania as well. And then after that, I worked for 2 years. After that, I got a scholarship, Japanese government scholarship, and I went to University of Tokyo. I did a 1-year research fellowship there, the University of Tokyo. And then after that, it followed by master's. I did master's in international health, and the focus was public health nutrition, and especially for kids who are living with HIV. And after that, it was, I think, success. And then I was again selected to continue with my PhD program. And I did it from 2012 to 2015. So I got my PhD then at University of Tokyo. And then I went right back to where I was, again, I got a job as assistant lecturer and then a lecturer at the same university. So I'm currently working at the Department of Community Health, School of Public Health, Muhimbili University of Health and Allied. And how did I came here to be here today? It was through Afya Bora fellowship. So when I was working, then one of my mentors introduced Afya Bora to me, and they said, like, I think this is going to be a good change in your career path also. At my university, my primary role is teaching. So I teach medical students. I teach those who are taking MPH, that is Masters of Public Health. And I also teach other courses which are public health related, and other master's program, clinical, but those who are taking, they have to go through some of the courses that we offer at the School of Public Health, including epidemiology, study design, and those things. So I mentor students, I assist them in their thesis, in their research, and then among other things at the university, I also do short courses, several short courses, some of them being on research methods, public health nutrition, and recently I've been doing some on systematic reviews and methods. So that is one part of teaching. Another one is research. As you know, as an academician, you have to do research as well. So one of my interests that actually drove me into academia, to global health, was to do research. And I do several types of research, one of them being public health nutrition, which is, my interest is on feeding practices for kids who are living with HIV, then again in the general population. Then also I do studies on adolescent health, especially in the context where we have a huge burden of HIV in sub-Saharan Africa. And I also, as part of my activities, do consultancy. So I've been assisting the government write several national guidelines. For the past 2 years, since I've been in Tanzania for my PhD, I managed to spearhead 3 national guidelines, one being for focused antenatal care for Zanzibar, another one for STIs, HIV for Zanzibar, and of recent for management, prevention of and management of nutrition related conditions for patients living or patients with multi-drug resistant tuberculosis in Tanzania. So initially, when I was young as 8, I wanted to be a doctor. So this was back in 1988 when I had a severe cerebral malaria. You know, looking at those doctors that were treating me, I really inspired me. And then my uncle went to Russia to do MD. That was a very long period of time, and he also inspired me to be a doctor. So since primary school, I really wanted to be a doctor, and I was working towards that one. So as I went through my medical school, then I realized that passion was also research. And this is what I wanted also to add in what interested in treating children. But then treating one child at a time, thought with burden of conditions we have in Sub-Saharan Africa, wouldn't be that enough. So why not sort of creating a situation that saving lives of several children? And as I was going through my clinical rotations, then I met one of my very first, her name is Professor Julie Makani, and she gave me an opportunity and exposed me to the first exposure to research by sending me to Kenya. That was a coastal town in Kilifi. And there I met a lot of people working on nutrition-related condition, and suddenly it became my focus of interest. Thought that by addressing nutrition challenges that we have in Sub-Saharan Africa, and especially for the vulnerable population, like those who are having HIV, and even in general population, really could actually save a lot of lives. And then so I worked with these people in Kenya, and when I came back to continue with fifth year, I knew exactly what I wanted to do. So it was basically nutrition-related research, care, and treatment, especially for kids. I went through my internship in one hospital in the Lake Zone in Tanzania, and I applied those, the simple WHO steps for managing prevention of undernutrition. And amazingly, we saved a lot of kids in that hospital. So after that, I think it really strengthened my career on that. And fortunately, I started publishing some of the work that I was doing. And after my internship, I went back and worked with other people in the National Hospital. But then I met also one of my current very strong mentor. His name is Professor David Urasa, who has been really guiding me through the process. He is the Dean of Public Health currently. And even when I went to Tokyo, I was still working with the two of them, Julie Makani and Professor Urasa, and they've been guiding me through this process. So these two people, I think they gave me a career, sort of, and they are still guiding me today. Yeah, so I must say that we are quite few. As you know, Tanzania is one of the 57 countries with a human resource crisis. But then specifically, you are talking about clinicians, nurses, etc. But for public health, we are way quite few. And having, most of the challenges in Tanzania of public health importance, they just need prevention, health policies, advocacy, health promotion to address some of. And our number is quite few. So what we are trying to do is really train as many people as possible, inspire as many people as possible, creating teams and looking for collaborations, which is one of the things that I'm doing here. And I think through that, we can address that kind of a. The second thing really, although the country has been making a lot of progress, but then the budget for research from the country itself is quite small. And a third and most important challenge that we have is the conditions that we still have in Tanzania. The focus really has been on infectious diseases currently, and we're making a lot of progress. For example, in HIV, in malaria, TB. So these are becoming less and less and less of troubles in all the population. But then still we have a persistent and not so commonly addressed, which is nutrition-related conditions. So while the focus is on infectious diseases, but then these conditions are left untouched. It's because that the focus of the country and the focus of the global community is not yet on that, and lack money, and not so many people are interested on that. Joining Afya Bora, I think, was the best of the current decisions ever made in my career. It has made me think in a different perspective. working together with teams with different professions. So in Afya Bora, as you know, there are diverse of groups from different countries. From US, we have fellows from the US, and we have fellows from Botswana, Kenya, Uganda, Cameroon, and then Tanzania. So bringing all these best minds together from different disciplines, not only doctors, some are nurses, some are researchers, some are just program implementers, and it creates sort of a very good combination. So it really gave me strong or strength in terms of working with teams. I was really weak in working with teams, weak with groups. But then after Afya Bora, I think I've really improved on. Another thing is the classes or the courses that we undertook in Afya Bora. Some of them, although very important, but then we must realize that we could not have time or opportunity to get some of these very important, and we are still using them. So for example, I after the grant writing module that we did, which was NIH based, was also being taught by one of the faculties from Penn. After that, then we wrote 2 grants back with my primary mentor, and then after monitoring and evaluation module, we did 2 other projects for monitoring and evaluation. So we immediately put the skills to work because there is so much that needed to be done back home. Some of the skills that we got in Afya Bora really helped me to what I'm currently doing now. One of it is communication. Communication modules help me to write better, to do better work, right, which is now becoming my primary role. As you improve in writing, the guidelines that I'm working on are really some of the products may say contribute to Bora. And then again, the links that I got in my attachment site, I got to work with the data that was not being used, and the analysis skills that I got, and the mentorship, and the number of people that I could approach now, the number increased. So I could at least go back and analyze those data, wrote a paper which was published a couple of months, 2 months ago, 3 months, just before the February fellowship. And this is on looking into characteristics and the magnitude of patients for adults who are just before they start on antiretroviral therapy. And this was important because even now we don't really have strong care and treatment, nutrition care and treatment for HIV positive children, I mean adults, of course, and children as well. And the problem is the infrastructure for care and treatment is only focusing on antiretroviral therapy, care and treatment, adherence, those kind of things. The other dynamics that can actually help this person benefit from the ARV, benefit, I mean, even having the good adherence for medication, such as nutrition, psychological issues. So I think my research is going to bring in the new perspective in terms of care and treatment. And the site that I was working with really took it very positive. So we are now going to analyze all the sites to see the demands, the needs, and see how we improve nutrition care and treatment. And I think Afya Bora has a lot. The first 10 days, working days, the first 2 weeks were basically the training on the course that before the clinical trials and translation research, and several faculties taking part. But besides that, I have been working with lots of people. I've been introduced to 12 people, different departments, both at Penn, outside Penn, and it was the work of the mentors that were. So first of all, I would really like to thank the mentor that was assigned, Jackie Mackenzie, who is a pediatrician, Children's Hospital, Pennsylvania, and she has really connected me with several both faculties, clinicians, researchers working at job and elsewhere. One of the person is Nadia Downshen. She is director of adolescent HIV research, and in job we contacted. We are going to work together to see how she can also have a role in project on adolescent health that I'm actually developing. And another thing, another person that was introduced to me by Jackie was Gianna Darlings and also Babette Zemal. This I'm going to meet them soon to discuss. So these are researchers in nutrition as well as clinical medicine. I'm going to meet them, see how they can help me in future endeavor. I also met Shiriki, Professor Shiriki Kumanyika. So Professor Shiriki, I met her a couple of months ago in Croatia. We served together in the WHO committee, and then, but meeting her at Penn opened a lot of possibilities. So Shiriki has linked me with a lot of persons at Penn, as well as, so she's an emeritus professor here, but she's also working in Bechtel, as well as in Bechtel. And she has colleagues all over the US because she's a guru in nutrition-related research. So she has connected me with people at Harvard, Bechtel, and here. One of the person that I'm going to meet this afternoon is Elizabeth Prout, and again, Philip Massey and Allison. And these are really vital in shaping my first work that I'm working now, but then my future project. I cannot really stop mentioning Rosemary Overman, who was really working hard to make sure that, first of all, we are comfortable here, but second, she has really given us lots of lectures, and on top of that, materials that we can keep on teaching other people, which was very unique even in academic field. People can give you notes to read or to give other people to read, but she has been giving us even slides, promising us, we can reach her anytime. I'd also like to thank everyone who made it possible. After traveling around the world in different universities, Penn gave me sort of a different perspective. People are so easily to engage. You can just make an appointment, walk right in, discuss your issue, introduce yourself. People are friendly, they are ready to listen. Second thing, the city is beautiful, very beautiful city, very active city. I've been running around in the morning with one of my mentors, Douglas Weeb, which is, again, you don't, in many settings, even at home, you don't really, not possible to have a morning run exercise with your mentor. So this was sort of a unique. I really wish for this program, be it with Afya Bora or any other, to reach out to the world. I know Penn has very strong collaboration with Botswana, and it is just starting to get its foot in other countries. This is very important in global health.